Hello, my name is Mugdha. I'm an occupational therapist. I've had a privilege of being a first in a lot of places. I'm the first batch of occupational therapy at Natal Hospital. I graduated in 1994. As the first graduate, we had a lot of fun learning because the cream of the cream taught us, as we were the first batch, we didn't have any seniors. From there, I joined Counsellor Hospital. I was the first occupational therapist there as well. After that, I went to the US. I worked in the US for 6 years with senior citizens in skilled nursing facilities and then in home health as well as in the school system in the US. When I was in the US, I understood the system of keeping up with your license by doing a lot of continuing education courses. And I've trained myself certified in PNF, in NDT, in brain gym, in sensory integration. When I came back and started working here, with the blessings of one of my mentors, got a job in Ecole Institute. Again, I was the first occupational therapist there as well. And started working after coming back from the US at Ecole. In a couple of years, I established my own practice. I have centers by the name of PROVO at Ante West and at Opera House. 19 years after my graduation, I decided I needed more education. So I pursued my master's. Final year of master's, I have a gold medal in Pediatrics in occupational therapy. I am part of a lot of schools for All-Inclusive Education Act, which came into being in 2016. So I work with differently abled children, be a part of the regular curriculum. So the first question that comes in your head will be, is it like physiotherapy? Not really. Physiotherapy is all about mobility, going from point A to point B. Occupational therapy works on independence. That means your ability to do things for yourself. So if you have a fracture and then you have a cast, and once the cast comes off and you need movement, that's when you would go to a physiotherapist. But if you have a cast and you still need to do your everyday work, then you would go to an occupational therapist. That is the basic difference. I work with children, so I'm a pediatric occupational therapist. So now the next question that comes into your head is, what is an occupational therapist working with a child? So, what is the occupation of a child? The child's occupation is only two things, to study and to play. Anything that comes in the way of these two things is where you would need an occupational therapist. For example, they are not able to sit in one place. They are not able to hold the pencil correctly. They are not able to tie their shoelaces. They are not able to stand in line. They can't sit for circle time. Or they have difficulty making friends. All of these things, and not limited just to these, is where an occupational therapist comes in.